Thank you, Mr. Speaker. I'm sure the Secretary of State is well aware that the Scottish NHS has been separate since 1948 and has been under direct Scottish Government control for the last 20 years. So there's actually 4 NHSs. Perhaps I can ask the Secretary of State about some of his decisions that have made it harder for the Scottish and other devolved governments to fight COVID. Last September, he refused to follow sage advice for an urgent lockdown. And the 6-week delay allowed the more infectious B117 Kent variant to emerge and spread across the UK, driving a second wave more deadly than the first. He has repeatedly claimed to follow the science. So can he explain why he didn't follow scientific advice last September?
Thank you very much, Mr. Speaker. Just on this point, this attempt at division within the NHS is deeply regrettable. Deeply regrettable. It's not what people want. It's not what people want in Scotland. It's not what people want anywhere across this country. The NHS is an institution we should all be very proud of. Of course, it is managed locally. It's managed locally across parts of England. It's managed under the devolution settlement in Wales and Scotland and health services in Northern Ireland, rightly so. But it ill-behoves politicians to try to divide the NHS. It is a wonderful institution that should make us all proud to be British. On the specific second question she asked, of course, we are guided by the science and take all factors into consideration. These are difficult judgments based on uncertain data, and we make the best judgments that we can, and that is still the process that we're going through, in the same way that the SNP government in Scotland has recently opened up parts of the rules in terms of social distancing in Scotland. Despite the rising cases, we face a challenging decision ahead of the 21st of June, but that decision is made easier, and indeed the decision to open up is only possible because of the UK vaccination effort. And today marks 6 months to the day since Margaret Keenan was the first person in the world to receive a clinically validated vaccine in Coventry, the same day as Scotland, same day as Wales, and since then we've delivered 60...
Order, it's not a statement, it's an